Congratulations on starting the veneer process. Here are some things to keep in mind for your temporaries for the next few weeks. The average time in temporaries is about 3 weeks, and in this 3-week period, we will be working closely with our lab ceramists to perfect the details of your smile and the veneers. The lab is custom crafting each porcelain veneer. The temporaries are one piece. They can often feel tight and uncomfortable. Half of our patients are fine, where the other half may have to take over-the-counter Advil or Tylenol to alleviate this discomfort while they're in the temporaries. We sometimes will prescribe a pain reliever as well, and if we did, you can take that pain medication that we prescribed every 4 to 6 hours as needed for pain relief. The temporaries can feel rough and not smooth, and the temporaries may stain. Again, they are one piece. Your porcelain, on the other hand, is smooth and won't stain and are individual. So any soreness or tightness that you feel in the temporaries will go away when you get your permanents. So in your temporaries, especially avoid turmeric, yellow curry, or bright green liquids. These can really stain temporaries. And if you do get stains on the temporaries that don't come off with normal brushing, then you can make a paste with hydrogen peroxide liquid and baking soda powder, and then use that as a paste to brush the stain off the temporaries. Again, this can only be used in the temporaries and not the permanents. If we did laser gum contouring, the gums may still be going through changes while you're in your temporaries. So make sure to water pick twice a day to get your gums super healthy. If you experience bleeding gums or sore gums, continue with the brushing twice a day and water picking twice a day to overcome this gum irritation. Oftentimes, patients will stop using the water pick when they feel or see gums bleeding, but you should actually continue the water pick to get over the gum irritation. Also, look into the PerioSciences gel or saltwater rinses to help soothe the gums along with a water pick and brushing. In your temporaries, we want you to avoid biting or tearing or chewing with the front teeth. Cut your food up and push it towards the back molars to eat with your back teeth. And try not to put direct pressure on the front teeth, so no tearing or chewing with that. This will help prevent the temps from breaking or chipping. If the temps do chip or break, if it's in the back and not visible, it's usually not too big of a deal, and that area may be sensitive, but just keep it clean. If there's a sharp corner, you can take a clean emery board and maybe smoothen it out. If you chip or break a temporary in the front and it's visible or sensitive, please let us know, and if you're local, we can get you in to repair that area. If you live out of town, then we probably will recommend seeing a local dentist to have it repaired. There are some products on Amazon that can be used temporarily, like temporary beads that can be used as an option as well, but they're only temporary. So if you have any questions or concerns about the design of the veneers, please email us with some photos of you smiling in your temporaries and any notes about any questions or concerns you have about the design. Pictures that work really well would be selfie kind of headshots. Those work perfectly, and that will help us see the temporaries so we can talk about any design changes that you'd like to make.